Give us a sense of how widespread the use. So let's just start with SSRIs, antidepressants. How widespread is their use in the United States?
About 14% of the population.
Total population.
Of the total population is currently taking an antidepressant medication.
Currently?
Currently, yes. Yeah. And that's actually as of 2014. The numbers have gone up since COVID. So I would say it's probably between 15 to 20%.
For example, they say it's a chemical imbalance. Did anyone ever describe what balance is?
This is like a white lie that people sort of rationalize to themselves. Because people have looked at the chemical imbalance, and there is a clear way to do it. You can look at the brains of depressed people on autopsy, and you can actually look at receptor levels and say, is there any changes in the receptors? You can stick needles into people's spine, and you can draw out fluid, and you can look at the metabolites of things like serotonin, and you can get depressed people and undepressed people and say, is there any difference in the actual amount of serotonin floating around in the brain? Every time they've done this, they have not found that there is any difference between depressed and undepressed people. But
there's no difference?
There is no difference. Because that's why we don't use any biological markers in the diagnosis of any psychiatric conditions. No brain scans, no blood tests. We can do all of those things. They're not useful because there are no ways, like actual biological ways to differentiate depressed people from undepressed people.
Are you serious?
Absolutely. Yeah.
Okay, so, well, that's not a white lie then. That's like a massive whopper. If you're telling me there's a biological basis for anything, but you can't show it, then you're lying.
Yeah.
Or guessing at best.
And the way they justify it was, well, okay, so we haven't found it yet, but it must be a medical problem, and we're eventually going to find it. And rather than admitting that, in the meantime, we'll just tell people it's a chemical imbalance because it's just an easy kind of like metaphor for them to understand, and it helps us dish out the drugs without people asking too many questions.
But it's untrue.
It's untrue.
Therefore, physicians should not say that, or they should lose their medical license.
They shouldn't have been saying it.
But yeah. I thought, like strict adherence to reality, honesty, I thought that was like a prerequisite for practicing medicine, getting a license.
Yeah. Well, what's happened in the space of psychiatry is almost like our field has become so overrun with pharmaceutical propaganda.
I'm a shrink, a psychiatrist.
Mm-hmm.
It sounds like for all the right reasons. You want to make people better, happier, more fulfilled, at purpose, all the good things. And then you wind up on this podcast with a totally different view of how your profession is helping or not. How did you get there?
Well, what I started to notice in my intern year was that it does not work. And this is the heart of it. You put people on these medications without understanding why they're unhappy. And so firstly, it's like, how could you expect to fix someone if you don't understand why they're unhappy?
Exactly.
And then, so putting that issue aside, like maybe we're just okay with like drugging people, they have unhappy, they're unhappy and we put them on medications. Maybe that's okay, although I don't agree with that. The drugs, they just wear off over time. You put someone on 5 of Lexapro, at a starting dose. 6 months later, the effect has usually worn off and they need a higher dose. 12 months after that, they need a higher dose. And eventually they're maxed out on it. And the person will say to you, I don't even know what this drug is doing anymore. Or it's hardly doing anything. And so at that point, they ended up getting put on more and more medications. And eventually you have people on 5 meds and the drugs aren't really working. And so I would see this pattern where, you put someone on a drug, you get this honeymoon period where, and they work. This isn't a placebo thing. Like these drugs, they turn down your emotional range. They are numbing. And if you're someone who's seriously anxious, you will experience that as therapeutic, maybe even life-saving.
Instant relief.
Yeah. Well, sometimes a couple of weeks, but practically instant.
Well, for benzodiazepines, it's like instant relief.
Yeah, for benzos, instant. For SSRIs, usually a couple of weeks. And so people, they'll get this experience where they say, this drug has saved my life, that I'm more functional. Yeah, during the honeymoon period where your body hasn't adapted to it, because our bodies, they just adapt to the drugs over time. And so I would just see them wear off, and the people would start accumulating more and more drugs, and then they would get slowly sicker. And I'm thinking to myself...
Sicker by which you mean what?
Like mentally sicker. They're, more fatigued, more brain fog, more depression and anxiety over time. And I saw that a lot. Lots of my patients were not getting better on these regimens. And so I would talk to my attendings and I would say, well, this doesn't really seem like a sustainable way to help people, putting them on drugs that essentially wear off over time and they end up sort of stuck on and they look worse. And they would tell me, don't worry, Josef, these drugs are safe and effective. They're approved by the FDA.
Did they actually use the phrase safe and effective?
Yeah. Yeah.
They actually use that phrase?
They use that phrase, exactly. These are safe and effective. They are approved by the FDA. Nothing to see here. Don't worry about it. Why would you be concerned about this? The authorities have spoken.
Are these actual doctors?
Yeah, these are professors.
They look at you in the face and say, "Don't worry, Josef. They're safe and effective."
Yeah.
You're freaking me out.
Yeah. And so I think I'm 26 at the time, but this does not sit right with me. And so I decide that, who am I? I don't understand this research. I'm going to become an expert in it. And so after residency, I go and I work for Janssen, which is the pharmaceutical arm of Johnson & Johnson. And I get involved in clinical development there, doing a fellowship so I could see how the pharmaceutical companies develop the drugs. I stay there for a year, and then eventually I go to the FDA and I become a medical officer in the division of psychiatry, where I'm overseeing the safety of the drugs on the US market. And it was by going through that experience and actually seeing how these drugs were developed over time that I realized that we are practicing so far outside of what the evidence shows, like in an insane way.
Like outside of science.
Outside of science, yeah. Like the whole idea that it makes sense to put someone on an SSRI for years at a time is not supported by the clinical research at all. It's a complete guinea pig. It's an experiment. It's an experiment happening on a mass scale.
Millions and millions of people.
Millions and millions of people, yeah. So, I said before, about probably let's just call it 20%, 15 to 20% of people are on these medications. Half of the people that use antidepressants are on them for over 5 years. And so, maybe 7 to 10% of Americans are essentially on an experiment where there's no clinical trial evidence that says that these drugs are safe. The scary thing is, when my doctors used to say to me, these medications are safe and effective, the thing that they would leave out was for the 12 weeks that they were studied in the clinical trial. That's and then when you look at the research, there has never been a randomized controlled trial that has looked at this over 12 months. And
12 months, but you said there are millions, tens of millions of people on this for years.
Yeah, taking them for years. And it is, and this is just insane, because anyone who has their eyes open will see that these drugs clearly wear off over time. That's why you have to keep on going up on the dose. And so it would be really important to actually see how effective these drugs are over time.
Well, why wouldn't they? They have the sample. It's right here. It's in America. There's a lot of people to choose from.
Yeah. They don't do it. And a lot of this happens just because of precedent, and there's a complete lack of backbone and leadership at the FDA to actually improve the way these drugs are studied. What was it like?
How does being on SSRIs affect people's relationships?
So the question, it's a question really about how does emotional blunting affect your ability to connect with one another. Yeah.
I guess you just answered the question.
Yeah. And so there is a Facebook group out there called Marriages Destroyed by SSRIs that I think has like nearly 5,000 people in there. And the stories you hear there are that, we were in a relationship, my spouse was, depressed, they got put on a medication. And so in some instances, they'll say that the person became emotionally distant. They stopped being intuitive about their partner. They stopped recognizing that there were issues going on, and they became kind of harsh and neglectful. And so I think it can get in the way of empathy. And this is a funny story, actually, because my wife and I, we both tried Zoloft. We got it from a friend of ours when we were in our residency because I wanted to see what it was like, these medications. I was prescribing them to people.
That's a benzodiazepine.
No, this is an SSRI.
Oh, okay.
Yeah, so I took an SSRI because I just wanted to see what it was like. And she hated me when I was on Zoloft.
She did? Yeah. Why?
Well, she felt like I didn't really care about her anymore. Like she would, we would be having she'd be upset about something. I don't know. The kitchen was dirty and I'd left a mess, and she'd be talking to me, and I'd just be like so zoned out, not caring about her emotions, emotionless, not aware, not being able to intuit things. Because in the past, like if I walked into the house and I could pick up that she was upset, I'd walk over to her and I'd say, hey, what's going on? I sense something is wrong. Let's talk about it. That went away. That ability to kind of detect, subtle kind of emotional changes in her went away, and she hated that.
What are the side effects of SSRIs?
So there are a couple, but I want to start with one which really doesn't get a lot of airtime, and that is actually the effect that everyone has. And so these drugs, they work through emotional constriction, and there's an opportunity.
What's emotional constriction?
Numbing. So if you're having like a lot of anxiety, negative emotions, it kind of just sucks it in. But it'll also take out the positive things. So many people will experience that as therapeutic. But the risk of this is that you miss an opportunity to actually address the real reasons that you're unhappy. Many doctors, they will not talk to patients about this. And most people have very clear issues why they're unhappy. They're having problems with drugs. They have relationship issues. They have work issues. They have, they're eating terrible foods. They have like massive insulin resistance or diabetes that has completely disrupted the energy system of their body, and their neurons are just starving for energy. If you're having these legitimate problems, you just throw a drug on top of it to mask that anxiety that is really like the smoke detector saying,
yes,
problem.
Yes.
And, I'm going to mention a whole bunch of other things that are important. We've got PSSD, we have brain damage during withdrawal, we have homicidal behavior.
Okay, so let's go in order.
Yeah.
PSSD?
Yeah, so this is...
What does that stand for?
It stands for post-SSRI sexual dysfunction. And from my perspective, this is the biggest scandal in psychiatry going on at the moment that has been not discussed. Now, there are people who get put on these medications that, firstly, one of the big side effects of these medications is sexual dysfunction. It happens in, I think it's like 70% of people who
70%?
Yeah. Yeah. So,
and when you say sexual dysfunction, since you're a doctor, we can just be totally blunt. What are you specifically talking about? Yeah.
So it would be like loss of interest in sex, loss of arousal, difficulty to reach climax, and erectile dysfunction.
Wow.
Yeah.
70%?
70%. It's a really normal side effect. But the issue is we tell people that this goes away when they come off the medications. And this is just a temporary trade-off, to feel less depressed. You're going to deal with the sexual dysfunction. But what we've been seeing is that these drugs are causing permanent sexual dysfunction in people, even when they come off of them. They develop, on top of all of those things I mentioned, they will develop genital anesthesia. And so this is a real like neurological issue. Like those areas down there, they lose erogenous sensation. People will say that when they touch down there, it feels like the back of their hand or the back of their arm. And so there's sensory changes.
Are you serious?
Yeah. And so it's totally frightening.
For how long?
It can be permanent for some people.
Come on.
Yeah. And so the prognosis is actually really, it's not good for that. Some people will recover in, 3 years or so, but there are case reports out there where this has gone on for decades. But
what?
But it's not just that. And here is
basically you're castrating people.
You're essentially castrating people, but it's worse than that. Because
how could anything be worse than that?
Because along with the sexual dysfunction, and this is where the condition is misunderstood. People think it's just a sexual problem, which is already horrific as is. It causes cognitive damage as well. People will along with that, they'll have severe difficulty concentrating, focusing, paying attention. And there's also severe emotional blunting. And so people will talk about being completely dissociated as well from their emotions. Like if you were to hug a child, your child or your wife, you just don't feel anything warm. If you were to hear a favorite song from your childhood that, used to make like the back of your neck kind of prickle from nostalgia, all of that gets like nuked and taken out. And so you have people who are essentially lobotomized with cognitive impairment who also have severe sexual dysfunction.
So you're basically destroying someone's soul. I mean, the things that make you distinctly human.
Yeah.
Your love, your emotional response, your sexual response, which is very deep. It's not just I'm horny today. It's like, it's your life force. It's your procreative force. It's what keeps the species alive. That's gone.
It's wiped out, and people become highly suicidal because when you don't feel anything, you don't feel any connection to life, it's like there's nothing to live for anymore.